Alrighty, I am here in the med room and I am checking. I gathered my supplies. I got my syringes. I got my things here. I checked the chart here of the patient. So I'm under Elena Peranowski. She's allergic to penicillin, and I'm just checking the orders here. So I went to orders and I looked at the orders, and I see what she's getting. All of these meds is what she's getting, and I'm checking the NUR just to make sure it transferred over. There's, I'm looking at every single med, so I compared the orders to the NUR. And now I am going to have my lovely cheat sheet out here that I've already completed, and I'm pulling up my cheat sheet that's already completed. And I know exactly what all these meds are for compared to that. So I've checked her history here just to make sure it's appropriate for her to get all these medications and see in her past medical history what she has been diagnosed for. And then I'm going to the NUR. So I already compared the history of the patient. So let me just go through each of these meds here to show you, and a clinical instructor that you know what you're talking about for check off. So acetaminophen is for an analgesic, and the purpose, it's a safe dose because I already went to up-to-date lexicon and I typed in acetaminophen. I checked the dose and it said it was an appropriate dose to give. So I know that that is already appropriate, but I already have it and I show you how I did that. I'm not going to do that right now, but it shows that it is appropriate. A side effect is liver toxicity with that. So a nursing consideration is I need to check maybe liver enzymes, but also I need to check her pain level. So I know it's appropriate to give based off of all of those things. The next med is enoxaparin sodium. The classification of enoxaparin, that is like a blood thinner. It thins the blood. She is getting that because she is actually on bed rest, and we're going to prevent DVTs for that because I saw in the orders that she is bed rest. So we're preventing DVTs here for her with that. So a side effect is too much bleeding or something like that, so nursing consideration. I have to make sure that I'm checking bleeding precaution. I'm checking for bleeding gums, anything like blood in the urine, stool, anything with bleeding. So I'm checking that. Is it appropriate to give? Yes, she's on bed rest for an acute illness, and she's had a history of a stroke before, so it makes sense that she's on enoxaparin. Okay, the next one, haloperidol, that is an antipsychotic. She is getting that because she's diagnosed with schizophrenia. It is a safe dose to give because I already looked that up in lexicon. I have my thing here that I checked with lexicon. So I know that that is a nursing side effect is maybe extra agitated behaviors. So nursing consideration, I'm already going to check her mood, her affect for this. And is it appropriate to give? Yes. All right, the next med she's getting is regular insulin. I know a classification of that is an anti-diabetic, hyperlipidemic agent. I know that she is diagnosed with type 1 diabetes according to her chart. I know it's a safe dose because I looked that up in lexicon. A side effect is hypoglycemia, so I want to check a nursing consideration. I'm checking her blood sugar and making sure that her blood sugar is within the normal range. And is it appropriate to give? Yes. Okay, lisinopril, that's the last med I'm giving. That's an antihypertensive. It's an ACE inhibitor. I checked up-to-date lexicon that it is a safe dose. A side effect is hypotension. So nursing consideration, I'm checking her blood pressure to make sure it's safe to give. So, you know, I'm going to actually check the chart for that, for all those values here. So let me go to patient summary. All right, so her blood pressure is 140/80, her heart rate is 80. Based off those values, I know that it's appropriate to give lisinopril. I'm going to check her last blood sugar. Can I remember where this is at? I'm going to results and labs, and I'm going to go to blood sugar. Okay, so her blood glucose is 180, so that's appropriate to give insulin. So notice here I'm checking that with that. So basically, let's go back up to my cheat sheet. So I've done steps 1 and 2, and I know that it's appropriate. All these meds are appropriate for this patient. So I'm going to perform hand hygiene right now. And I am right now in my lovely med room here. I am not in the patient's room. I'm in my lovely med room. And I'm going to prepare each med at the one I'm gonna prepare Elena Peronowski's all together right here. All right, I'm gonna unlock the med drawer, and I'm preparing medications for one patient at a time. So now I'm gonna actually read the MAR. I'm having the MAR up. And again, we're gonna pretend that it's always 9 o'clock, so we're never gonna be late, so there's that. So first is acetaminophen. I see the MAR there. I am pulling off the chart. Notice, I did not do my med math yet, so I still gotta do my med math for my step 1. So let's see here, and I'm just gonna do it per each med. So acetaminophen, it's 500 milligrams per 5 milliliters. How many milligrams do I need to give? I need to give 750 milligrams, so I need to do some med math here to make sure I'm giving the right milligrams because it is coming in a lovely dose here. Can I steal your med cup? So how many milliliters do I need to pour to get 750? I need to do the med math. I can already have that on a cheat sheet if need be, and I already have that out.
7.5 milliliters?
Yes, thank you. Oops, sorry, let's do this. Sorry, there it is. Yeah, so I already did the med math. I double checked it. I need to get 7.5 milliliters. Jeez. Oh, peace. Okay, good. Perfect. Okay, good. There's a 7.5 milliliter tab right here. And I'm checking this med. This is acetaminophen. Acetaminophen. I am pulling up this med. I am touching it to my computer screen. Acetaminophen, acetaminophen. I'm picking this med up twice to make sure it's acetaminophen, acetaminophen, twice. Putting my hand here, right here like this, and I'm pouring. I'm keeping this lid up. Here. Sorry guys, this is really hard for me to see. Okay, so these right there. Geez, usually I have like a black line. Just attention. Okay, that's 750 milligrams because it's 7.5 milliliters. I am sticking it right here because everything needs to be labeled. So I am putting this label of acetaminophen right here on my lovely bar chart. Bam, that's acetaminophen there. Okay, let's look at the next one, enoxaparin. All right, geez, I need to get 750 milligrams of that. So how many milliliters do I need to use to get 40 milligrams?
I'm gonna say what?
Wait, did I say that right?
You said 750 and then you went to 40 milligrams.
Sorry, okay, enoxaparin, sorry, thank you, correction. I need to get 40 milligrams of enoxaparin. I'm getting this vial. Guess what? This vial automatically says enoxaparin. I'm checking here, there. I'm pulling up enoxaparin. This vial says enoxaparin. I'm checking it twice with here. I need to get 40 milligrams. So it comes in 100 milligrams per milliliter. So how many milliliters of, how many milliliters do I need to give of this?
Like 1?
It's 0.4 milliliters. So I have this top. I'm alcohol swabbing this top. Every time I access a vial, I do that. I am getting a sub-Q, because it's a sub-Q needle. I'm making sure that this is a sub-Q needle. This here is there. And, I am pulling up air. I am getting 0.4 mLs of air in this syringe. I know this is 0.4. I am putting 0.4 of air into this air of this vial right here. I already alcohol swabbed this. You need to come closer, you guys can. There's the air into air. I'm gonna flip this over just like this. And now I'm withdrawing 0.4 milliliters. I got a little air bubble, so I'm getting off the air bubbles. I'm gonna get that air perfect. All right, so this is enoxaparin. I'm gonna use the one-hand scoop. Other people change out the needle to have a fresh needle, okay? So however your facility does it. Alright, so this is 0.4, this is enoxaparin, I checked enoxaparin. I am labeling this syringe enoxaparin. And I'm labeling it by putting it right there on that label. It's labeled. Alright, let's go to the next. Alright, Haldol. I have Haldol here. I need to get 4 milligrams of Haldol. It comes in 5 milligrams per milliliter. So how many milliliters do I need to draw up? And I would have that med math already done. And guess what? This vial automatically becomes haloperidol. I'm checking this vial. Haloperidol. This is haloperidol. See how I checked it twice with that? I checked it. I'm alcohol swabbing the vial because you always do that here. And now haloperidol, that is an IM. So I need to get, let's check, I need to get an IM needle. Okay, so notice how I'm getting a correct needle, the correct syringe, the correct amount. And now how many milliliters do I need to withdraw? See, look at the IM, it's a lot longer needle. And it's 0.8 milliliters. There, I got the air, 0.8 milliliters. I'm going here in the vial, I already alcohol swabbed this. I am putting this air of the syringe into the top portion of this vial right there. Air goes into air. Then I flip it up and over like this. And now I'm withdrawing 0.8 milliliters. Oh, that bubble. 5, 6, 7. I like to count. 5, 6, 7, 8, 0. Okay, that's good. There's no bubbles. Again, some facilities make you switch out the needle. Others will want you to reuse the needle. So based off your facility policy, you're gonna do that. All right, so this is my haloperidol. I'm double checking again. 5, 6, 7, 8.8 milliliters is exactly 4 milligrams, okay? So I'm making sure that, and guess what? I'm labeling it right here on my sheet so that haloperidol is labeled. I have that. Let's go to the next med, regular insulin. All right, it's 4 units of insulin. So again, this vial automatically becomes insulin, people. Now, insulin is nice because you never need to do math because when it says 4 units, you actually get 4 units. Insulin always has this orange cap. So insulin's lovely. I'm gonna use alcohol swab right here. For insulin and acute care, you always have to have a facility, another nurse verify the dose. I'm getting 4 units. Notice here, I checked the syringe, I'm getting 4 units of air. I'm putting 4 units of air into the air portion of the vial, and then I'm flipping it over, and then I'm pulling up 4 units. And that's perfect, and there's no bubbles. I have 4 units here, and I'm just going to recap using my hand, using the scoop. 4 units, 4 units, 4 units. I'm good. Nurse, can you check this? Yes, second thing of nurse, perfect. 4 units here, there. All right, my last is lisinopril. Down here, I need to give 10 milligrams. It comes in 10 milligrams per tablet, so I'm just going to pretend any one of these tablets. And I know it says a different med on here, but automatically it becomes lisinopril, and I'm double checking it, lisinopril, twice. I caught it twice. And now it's labeled lisinopril because it's right here on this label. I have all meds labeled. Lab instructor or clinical instructor is gonna verify all these doses. They're gonna double check this for your check off, right there like that. All right, so let's just check to make sure I did all this stuff right. Where did that go? Okay, I checked all the expiration dates also, and they're good. I've already done that. I'm not scanning until I get to the med check. Okay, so I'm gonna lock the patients there, and I'm gonna go actually into the patient's room. Okay, I'm just gonna go here. Here's my lovely patient room. And here's this med. I have my computer up because now this is where I'm going to scan here. All right. All this is locked. All right, here we go. Knock, knock, knock. Hi, Elena, I'm Deanna. I'm gonna be your nurse. I'm gonna give you your meds. Can you please verify your name and date of birth? And it's Elena Paranowski, date of birth, da, 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 da. I have my MAR up. I wanna show you that I have my MAR up. Because you have to have your MAR up when you're doing this. Oh, where did my MAR go, guys? There it is, perfect. Ooh. Okay. So Elena, your name, Elena Paranowski, date of birth, da 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 da, it matches. Here's the scan barcode, you're allergic to penicillin, right? So scan, beep. All right, good. You're allergic to penicillin, you are getting acetaminophen, that's for pain, and enoxaparin. You're getting that because we want to prevent DVT. Oops, sorry. Haloperidol is for your schizophrenia, regular insulin's for your diabetes, and lisinopril is for your hypertension. Okay, I already know your blood pressure is good. It was 140/80. Your heart rate was 80. Your blood sugar is 180. So you're all set, ready to go. Do you have any questions? No. Good. Great. Alrighty. So I'm going to scan all the meds right now. You're going to go.
3 minutes.
Thank you. I'm going to go over. Beep, 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 beep. All the meds were scanned. That's your third check. Your third check is completed because you scanned everything. All right, Elena, I scanned all your meds. It was all right. Let's start with your acetaminophen because I scanned all these meds. Can you please sit up for me? Yep, sit up. Good. I can't lift this up because this is very heavy. All right, drink, drink, drink. Do you need some water with that? No, I'm good. Okay, perfect. Okay, your next med here is your enoxaparin. That's a sub-Q. I'm either going to give this 2 inches around the umbilicus. I'll probably do either your lower right quadrant or your left lower quadrant. Do you have a preference? No? Okay, perfect. I'm going to then give it in your right lower quadrant of enoxaparin. And I used hand hygiene. We're doing this again. All right, so this is in her right lower quadrant. I'm doing this in a sub-Q way, so I'm going here. This is her enoxaparin. Right here, I'm going to pinch the skin. I'm going to go at a 90 to 45-degree angle. Right here, I'm going quick in, quick out. Right here, up, and I'm putting it directly into the sharps. All right, and now I'm going to give you your, I'll just go in order. I'm going to give you your haloperidol. You can have it in the vastus lateralis or your deltoid. The vastus lateralis is you, one hand on the greater trochanter, one hand on the patella, 1/3, 1/3. It's the outer third right here of your leg muscle, or you could do it on the deltoid. Here's your acromion process. You go 2 to 3 fingers down. That forms the base of the triangle. Right there, acromion process, 2 to 3 fingers down. That's the base of the triangle, so right there, that's where your deltoid is. Where would you like that? In your left deltoid, great. So I'm going to do that. I'm going to prep the site. I'm going to do the Z-track method. I'm going to push the skin over just a little bit here. I'm going to go at a 90-degree angle there. I'm going to aspirate, make sure I'm not in the blood, any of the veins. Then I'm going to slowly inject. 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to hold it for 10 seconds. 10, 9, 8, 10 seconds are up. There. I'm going to put on the safety click and put that directly into the sharps. And then I'm going to do your insulin for you. All right, your insulin. Again, this is a sub-Q shot. You can get it in your the back of your upper arm. You can get it on the top of your thigh. Let's do it in the back of your left arm. I'm going to forget all these sites, guys. You're going to have to help me. Right here, so I'm going to prep the site. And again, this is a sub-Q shot. So I'm going to go pinch here, ready, directly in, quick, quick, quick. Here, this goes directly into the charts. And then your last is your lisinopril. You wanna take that, we'll have you hand hygiene. Take this, pull it out, swallow that with some water. She's sitting up, I can't move her, she's sat up. Right now I'm going to chart. Show you how to chart. All right, I'm gonna click on this box, scanner. I'm just gonna say scanner wasn't working because it does not work with this thing. I'm gonna update chart. Scanner wasn't working, I'm gonna hit submit. So here's my acetaminophen. I gave this acetaminophen. I gave 750 milligrams. I gave 750 milligrams. The pain level was at a 2. And we're gonna update chart. Oh, wait, I'm gonna add another medication. Sorry, enoxaparin. Done. And I'm going to add another medication because when I scanned all of them, it came up. I'm gonna add them all. Alright, so here's all the meds. Alright, so I gave acetaminophen, I gave milligrams. There, 750, her pain level was added to enoxaparin. I gave 40 milligrams. Her pain level is not there. That's good for that. Haloperidol. How much did I give? I gave 4 milligrams of haloperidol. You know what I want to do for enoxaparin though? I want to do the location. I thought that lower abdomen, I thought it was lower right, did I say? Okay, thank you. For haloperidol, I gave that in her deltoid. I don't think that was her left deltoid, I said. Was that right?
Mm-hmm.
Okay, thank you. Oops. Lisinopril, the blood pressure was 140/80. I gave 10 milligrams of that. So I have that, okay. That insulin, I gave 4. And I'm gonna go suck down to units. Oops, can I spell? Units, and then the location, oh, where was it? Back of the right upper arm, was it? You guys remember?
I
Can't
think
remember if it was right or
so,
left.
I don't know.
I can't remember which arm.
Everything is right there. I go.
Okay, I'm just gonna say right arm.
I mean, we get it.
Right arm, I'm gonna do right arm. Alright, I had a nurse witness it that was, Lloyd, witnessed, making sure that it was 4 units, and the per night blood sugar was 180. Okay, let me just check all my charting. Got that for 140. Deltoid right over there. That milligram is right. That's there. Enoxaparin's right. Okay, I think that's good. So then I'm going to click update chart. And there it's done. How long did it take me?
About